Well, diabetes is a condition where the blood sugar level rises because either the pancreas gland isn't producing enough insulin or the tissues become resistant to the effects of insulin, so you have a relative lack of insulin. There are two main types. Type 2 diabetes is very much the more common type, and this affects people who tend to be over 40 and who tend to be overweight. Type 1 diabetes affects younger people, and these people stop producing insulin at all and will always need insulin injections. Type 2 diabetes, the more common variety, is very much a lifestyle condition. We know that people who never exercise, people who are considerably overweight, over 40 and who have a family history of diabetes are much more likely to develop this condition where there is resistance to the effect of insulin in the body. Because of this effect, the blood sugar level can't be reduced by that uptake of sugar in the cells of the body for energy. So the blood sugar level tends to rise, creating symptoms of thirst, of wanting to pee more often, of feeling tired, and sometimes a visual disturbance. Many people feel that they're not going to develop diabetes because it doesn't run in the family. Certainly a family history raises your vulnerability, but it isn't the only factor. You can still develop diabetes if, for example, you become overweight over the age of 40 and don't exercise enough. These lifestyle factors really contribute because the larger people become, the more belly fat they have, this fat acts like an extra organ of the body, producing hormones that make your body resistant to the effect of insulin. Insulin is what enables you to utilize glucose in the blood for energy in the cells of the body. Without insulin, that glucose for energy can't get into the cells. So people can feel very tired, very lethargic, and develop the other symptoms which I've talked about. Well, diabetics can largely manage their own condition by taking more exercise and controlling the amount of sugary, starchy foods or carbohydrates that they take on board. With the right balance, they can control their blood glucose levels, and of course they can monitor their blood glucose levels with various meters and with blood testing devices. Now, of course, lifestyle measures sometimes won't control all their rises in blood sugars, and they will need to take either oral medication or sometimes they'll require insulin by injection. Now, when it comes to oral medications, there are many different varieties to choose from. At HealthExpress, you can obtain things like metformin, Compitact and Januvia. Obviously, when you've previously been diagnosed with diabetes and prescribed by your own doctor, and you can have an online consultation with the doctors at HealthExpress. You might also like to remember that if you need to lose weight with diabetes, you can obtain Xenical, if it's appropriate for you, by having an online consultation with the doctors here.